Hello, my name is Daisy Gomez and welcome to the Fine Motor Skills and Handwriting presentation. I'm an occupational therapy student from the University of Texas Medical Branch. Before you continue watching this video, please click on the pre and post survey form in the description of this video and go ahead and take the pre-survey. And with that said, let's continue. So what do you think fine motor skills are? Go ahead and pause this video if you need a little bit of time to think. What are fine motor skills? Fine motor skills involve the coordination of small muscles in the hands and fingers to perform tasks that require precision and dexterity. So here are some examples of tasks that require one to use their fine motor skills. So writing, drawing, and cutting with scissors, using a spoon, fork, or knife to eat, buttoning, unbuttoning, or zipping clothes, or manipulating small objects in general. Why are fine motor skills important? They're important for achieving independence. If not addressed, it can lead to participation limitations in activities of daily living, ADLs, like dressing, feeding, toileting, play, and it can lead to participation limitations in school, like being able to write, draw, cut. Do you know any components that make up or affect fine motor skills? Go ahead and pause the video for an opportunity to think of your answer. Okay, here are components that make up / affect fine motor skills. We have bilateral coordination, pinch and grip strength, separation of sides of the hand, arch development, finger isolation, thumb web space, finger and thumb opposition, wrist stability, posture, and visual perceptual skills. So occupational therapists will formally assess these to identify what the problem is. So everything in the previous slide, OTs will assess. How to tell if a child has fine motor skill difficulty. Their hands fatigue easily when doing a fine motor task, difficulty using scissors, difficulty drawing or holding a writing utensil, have immature pencil grasp for their age, difficulty with tasks that require precise manipulation, like buttoning a shirt or zipping up a jacket, difficulty doing age-appropriate self-care tasks. So an occupational therapist can also assess a child's fine motor milestones based on an assessment or even like a formal assessment they might have. So these are the fine motor milestones for ages 2 to 3, ages 3 to 4, and if your child isn't meeting these milestones, then potentially they're having a fine motor difficulty. And here are more milestones for ages 4 to 5 years old and 5 to 6 years old. Please go ahead and feel free to pause the video and read through these milestones. Before continuing, if you have any concerns with your child's fine motor skill milestones, make sure to consult with your pediatrician to see, to talk about your concerns about the fine motor milestones. Okay, so now, interventions to improve fine motor skills. It is individualized to the child, so whatever was noticed in the assessment, whatever deficit there was, that will be targeted in the therapy. It will look like purposeful play, and it will target the skills noted in the assessment. Okay, so here are some ideas of what a session might look like here on the side. Next, we will discuss handwriting. Okay, handwriting. It's important for academic participation, and it can be substituted for typing if a school allows an accommodation like that. So handwriting is a complex skill that involves fine motor skills, visual motor coordination, motor planning, cognition, like attention, concentration, visual perception, sensory processing, so senses related to touch, sensation, and or movement. And occupational therapists assess all of these skills when it comes to handwriting. If a child is having handwriting problems, this is what we might see from the outside. So attention and vision problems might lead to letter omission. Visual perceptual issues might look like difficulty with letter discrimination and copying skills. Fine motor problems might look like poor handwriting, and the child may have many writing errors in general. And then sensory issues. So that might look like applying too much or too little force when writing. Here's what we might see continued: poor letter formation, poor diagonals in writing, awkward pencil grasp, poor letter size, poor spacing, inconsistent letter sizing, slow writing speed, and reversal of letters and or numbers. Intervention to improve handwriting. So the intervention, of course, will be tailored to the child's needs. But in general, it can be to improve their fine motor skills, improve visual perceptual or visual motor skills, improve posture, so developing their core and upper body strength, or implementing a program called Handwriting Without Tears. And it is a motor and multisensory approach, which we will discuss more in the next slide. Okay, so here's more about handwriting without tears. So it follows these general stages. So the child will watch and then imitate the letter formation. There will be guided practice and then independent practice. Handwriting without tears uses a multi-sensory approach. So it will use visual, tactile, kinesthetic, and auditory learning styles to improve understanding and comprehension of handwriting. And as you can see at the bottom, there are use of manipulatives like these wood pieces where they're forming letters from wood pieces. There are stories, forming letters with Play-Doh, with chalk, just so many different ways to teach letter formation. And there was actually a study done on handwriting without tears, and it is shown to be effective at teaching handwriting skills to children with autism. So here is an example of handwriting without tears for the letter F. So you can see the arrow. So first you do one line down, or big line down, 2 little line across, 3 little line across. And it uses consistent terminology, so it's not confusing or anything. Here is another example. So for the letter B, so big line down, 2 little curve, and then little curve again. So these pieces right here, these are the wood manipulatives and a mat. So the child would be forming the letters with the wood manipulatives, and then with chalk, and then writing it down. So there's just many different ways to practice writing. And again, here is a final example. So we have the magic C. So the magic C makes an A, and the magic C can make a D. And then here's just a creative way of forming the A. So you do a magic C and you go up like a helicopter, bump, and then back down. And then to make the D, you make a magic C, up like a helicopter, up higher, and then back down, bump. It's just creative ways of teaching kids to write. Allow me to leave you with this question. Do you know a child that may be struggling to meet their fine motor milestones or are having difficulty with handwriting? Is it interfering with their ability to participate in daily activities? Okay, and with that said, please fill out your post-survey form. And also, if you're interested in looking at the resources that I have for this particular presentation, then I will link the video about the resources in the description box of this video. Thank you.